corruption uncovered at Tembisa Hospital has now ballooned to 2 billion rand. The SIU released an interim report into the ongoing probe, which also revealed that 3 companies linked to a syndicate and controversial businessman Vusimuzi Kat Madlala pocketed over 13 million rand. The SIU has identified 3 major syndicates that have allegedly misappropriated funds meant for healthcare at the Tembisa Hospital. SIU head advocate Andy Mutibi says analysis of thousands of procurement bundles have revealed serious maladministration and procurement fraud implicating key officials from the Gauteng Department of Health and Tembisa Hospital. The SIU has prepared 116 disciplinary referrals against 13 officials, of which 108 were delivered to the Gauteng Health Department relating to maladministration as well as the irregular appointment of service providers at Tembisa Hospital. To understand the challenges faced by health workers on a day-to-day in hospitals like Tembisa, we're now joined by Chairperson of the South African Medical Association Trade Union, SAMATU, Junior Doctors Committee's Dr. Talente Biyela. Very good evening to you. Thank you so much for your time as we try and perhaps get an understanding from your perspective as Chairperson of the Junior Doctors Committee. How has corruption at institutions like Tembisa Hospital impacted frontline healthcare workers and patient care?
No. Good evening. Thank you for having us. Good evening to your viewers, obviously. I think at a macro level, obviously, it would be just seen as a corrupt syndicate. But if we take it down and we break it down into a micro level, when healthcare workers are concerned, this is seriously concerning. I mean, in as far as the service delivery towards our patient and patient care in general is concerned. I mean, you would know that between the period of January and up to the last time I checked was in June, there's been a massive resignation of healthcare workers in that hospital, particularly Tembisa.
Yeah.
It's alleged that about 225 healthcare workers have resigned since the period of January until now. Of the 225, it's 147 nurses and 43 doctors, which then speaks to the morale of the staffing in terms of the Tembisa Hospital, which ultimately obviously impacts the direct type of patient care that we give to our patients. So this is unacceptable. 2 billion rand is diabolical at the very least.
Yeah. I mean, over 200 healthcare workers having resigned speaks to a much bigger problem. What are your thoughts when it comes to the gaps in governance which allow such syndicates to thrive within a public hospital? And what accountability structures do you think SAMATU would like to see unfold? I mean, you speak about 225. That's a substantial number for just one institution.
No, 100%. And of course, you and I would agree that, I mean, there's been a massive unemployed healthcare workers now in the country,
yeah,
stemming from 2 to 3 years ago, which was something that was never seen in the past. And this speaks directly to this rampant corruption that is running in our country. Now, what I want us to also just zoom in is to understand at the micro level what happens. Now, if you're having 2 billion rands that is allegedly siphoned from Tembisa Hospital, which I am more than certain that if you dig deep into the Gauteng Department of Health, you may be just surprised that it's not only Tembisa Hospital. It's just that it is Tembisa Hospital that was flagged. So in terms of the systems that could be put in place, I think you would also agree with me that South Africa generally does not have a financial problem. South Africa has a leadership crisis, and this is why we find ourselves here. So even with this massive corruption that has been uncovered by the SIU, we don't want as healthcare workers to find ourselves having to listen to another inquiry, another commission, another this that will not lead to arrest, that will not lead to those who are seen to be perpetuating such things to be held to account.
Yep. Many of the corrupt practices involve procurement in some form or fashion. How do you now believe that procurement failures, filter down to affect daily medical practice, from the lack of basic supplies to compromised treatment outcomes and morale, as you touch on?
So this is fairly easy. In a hospital settings, there are things that we use to be able to discharge a particular patient care. For example, there was a time in a hospital where I work in, which I will not disclose.
Yeah.
We couldn't do operations because the linen was not available. More often than not, you can't find the correct size catheters, you can't find the correct size gel codes, you can't find this, that, and the other. So as a result, we end up compromising the patient care that we're supposed to give to our patients, which is unfair. I mean, fine, we may not necessarily be involved in the procurement issues, but the problems within the procurement issues eventually and effectively trickles down to us and the type of patient care that we give to our patients. It is so unfortunate. I mean, in Tembisa, for example, casualty bent down in about April. To this date, it has not been fixed, but there's an alleged 2 billion rands that has been siphoned. So obviously, it will have an impact and a great impact on the patient care.
Yeah. And how are you as SAMATU planning to leverage this moment? I mean, yes, it's a negative, but it's also an opportunity to advocate for broader structural changes, and not only for doctors, but for the protection of patients who ultimately suffer the most because of corruption.
No, 100%. I mean, part of the many things that we're going to be demanding, one is accountability. And those that were found to be alleging to have committed this type of fraud, and this syndicate must be brought to book. But over and above that, this as junior doctors makes us sick, to say the least. It's diabolical, it's unacceptable, it's unpalatable. And I'm saying this because there are thousands of junior doctors that are sitting at home that are not working, but there is money that is siphoned somewhere and redirected to other things. So part of the many things that we're going to demand, one is to have a sit down with the Minister of Health, try to find out and figure out how this is going to work out, how are people going to be held accountable, what are the new things and premises that are going to be put in place so that the people that are alleged to have done this are brought to book, and subsequently what are the reform measures and consequent measures at least put to the hospital, because also you'd understand there's a serious leadership crisis in Tembisa Hospital. When was the last time we had a permanent CEO, for example?
Yeah. Important questions without many answers, but we do thank you for your time and speaking to us this evening. Chairperson of the South African Medical Association Trade Union SAMATU's Junior Doctors Committee, Dr. Talente Biyela.